The views expressed on this program do not necessarily reflect those of this station.
Welcome to Insights into Northeast Michigan, a WBKB News public affairs program. Insights deals with the issues affecting those in the community, as well as Northeast Michigan and the state. And now, Insights into Northeast Michigan.
Welcome everyone to this edition of Insights. I'm your host, Velena Jones, and today we'll be looking at the role of a nurse practitioner in the medical field and how that's changing. Joining me now is Rhonda Keller, who is one of the partners at Healthwise Medical Clinic in Alpena. Thanks for joining me, Rhonda.
Thank you for inviting me.
So you have been a nurse practitioner for several years now. What made you decide to open up your own clinic?
I think the opportunity arose for myself and my partner, Casey Lechel. I think we've always had that dream of doing something a little bit bigger and be able to help the, citizens of Alpena and help our patients. I had been a nurse practitioner for a long time and had an established patient load, and the opportunity arose, and we're very excited and very happy with our clinic and being able to serve our patients and their families.
Mm-hmm. And as a nurse practitioner, you guys take a more holistic approach to the medical field. What's kind of the difference between being a nurse practitioner and when people go see a regular RN?
Well, the difference is education and experience. A registered nurse has 4 years, they have their bachelor's degree, and as nurse practitioners you either have your master's degree and many have their doctorate degree too. And then there's clinicals and experience that goes along with it. So basically advanced education and experience.
Mm-hmm. And as nurse practitioners, you, like we said, you take a holistic approach, but also it's more about educating the patient. Why is that so important?
I think if you're able to educate the patient and inform them of why they're doing things and why we recommend that they change certain ways that they're eating or with their diet or medications, I think they're a better partner in their own health care, that they can know and take care of themselves a lot better. I think education is key in counseling them so that they're not just taking this pill. We educate why you're taking it, why it's important. Mm-hmm. Helping them be a partner in their health care.
Right, and even more so, you guys also kind of hammer it to the patients themselves about preventive care.
Right.
Why is that important for them?
I think it's very important for preventive care if we can be able to prevent them from experiencing any kind of illnesses and diseases down the road. I mean, we take primary prevention very highly in our office and are treating our patients, getting the flu shots and getting their immunizations and their physicals and, routine blood work to prevent any kind of illness or disease to make them feel better and live life longer. And
How are you able to kind of focus on your patients more so than maybe if you were at a different practice?
I think just being able to better serve them in our own practice. We have excellent staff, be able to give them the disease prevention and the education that they need, counseling. We work with other physicians and specialties in the area as we need to, meet their healthcare needs.
Mm-hmm. Okay, and everyone's talking about the Affordable Care Act and Obamacare, and with those new changes coming next year, how do you see that affecting your practice and your patients?
Well, I think those patients who haven't been able to have insurance will be able to receive medical care. And as nurse practitioners, we can provide the services for those patients and get them the health care that they need.
Mm-hmm. And and then going off of that, why is it so important for you to kind of be that person in the community that allows patients to be educated about different diseases and preventive health care?
I think we just have a very warm environment, and we just want to provide them the counseling education that they need to be able to better take care of themselves and live a long, nice life and have them be well. And if they do have diseases, to be able to treat them and get them the best care that they can.
Mm-hmm. And within the Healthwise clinic that you operate, how do you try to inform your patients of different preventive measures that they can take that maybe they hadn't even thought of before?
We do that at each visit. We try to make sure when they come in that are they due for their mammogram or their bone density, and even if they come in for a cold, we're just often looking at those health maintenance activities if they've, had those taken care of for that year or whenever it's recommended. So.
And with healthcare is always changing. How do you guys continue to try to have a leg up on the medical care industry?
I think by education. We go to a lot of nurse practitioner conferences and medical conferences and read daily to be able to stay up on the updated, any kind of updated information that's needed.
And why is it so important to you for your clientele to know that being a nurse practitioner, some people think you may need to go to a doctor, but you can handle what they need right there in your office?
Correct. Yeah, we treat both acute and chronic disease states, and we can provide them medications and write them prescriptions and, take care of the needs that they need. So. Similar to what a physician can do in primary care.
Right, and why is that so important for you to be able to provide those services for your patients?
Because that's what we love to do, and we like to take care of patients and, make them feel better and do whatever we can to make them the best person that they can be.
And being a nurse and then a nurse practitioner, you've been in the medical field for over 20 years. Why is it so important for you to continuously provide that service?
It's a passion, I guess, to see them come back and feel better and to be able to, make positive changes in their life. It's just very rewarding and very gratifying. We're very lucky in this community.
All right, well, stay tuned, because after the break, we'll talk to Kasandra Lechel, who is also a partner at the Healthwise Clinic, and we'll talk about a bill in the Senate that will help the medical industry. Welcome back from the break, everyone. Joining me now is Kasandra Lechel, who is also a nurse practitioner at the Healthwise Clinic in Alpena. Thank you for joining me today, Kasey.
Thank you for inviting me.
Absolutely. And so starting off right off the bat, why did you decide to become a nurse practitioner?
As I continued in my education with my associates and then with my bachelor's, I had a sense of fulfillment and enjoyed that very much, but yet there was still a little something more that I wanted to learn and I wanted to do. And I had the opportunity to follow around some amazing people and go to some wonderful teaching institutions that showed advanced practice nursing. And I really felt that there was a draw towards that, and that is where my next step took me.
Great, great. And the nursing field is constantly changing. What does that mean right now for nurse practitioners? How's that role changing?
It is variable depending on what your specialty or what your interest is. And more so with there being a shortage of primary care, when so many new graduate nurses, unless they really know what they want to do, it's so important to have a generalized basis of knowledge of a little bit of everything. And because that is the hole that is being filled within the communities, since so many physicians are going on to specialties, more so the vacancies are in primary care.
Oh, okay. And so recently, just last week actually, Michigan passed in the Senate a bill that would allow for nurse practitioners to write prescription medications without a third-party family practitioner. If that bill passes in the House, how would that change your practice?
Currently, what we have is a delegated prescriptive authority through a collaborating physician, and therefore that would be an entity that would no longer be necessary for us. It is with the understanding that we have the knowledge and the same level of medical education to be able to write this prescriptions the way that MDs do. But as far as we would just be able, there would be one less cook in the kitchen, and provide us the opportunity to be autonomous at that level again.
Right. And like you said, as nurse practitioners, you have a certain advanced level of education that comes with that title. Why is it so important for this bill to pass in your eyes?
To give the credibility and for so long I think that nursing has not had its full recognition the way that it should. And as we continue in our advancement in our training and the knowledge that we have and the knowledge that we are required in formal education to have to allow us to practice at the capacity in which we do, the sky's the limit. Nursing is such a wonderful opportunity to explore any interest, whether or not any specialty. So really it would allow and probably attract more individuals to wanting to become advanced practice nurses and becoming nurse practitioners without having further obstacles.
And you are a partner at the Healthwise clinic. As being a partner, how has that changed the role in which you provide to your patients? Have you been able to provide for them better having your own clinic yourself?
I believe so, because we have very high standards, and we expect all of our staff and all of our support staff to hold those same levels of standards of care. And I'm very proud of that. We're very happy. We work very hard, and we're a great group of people together. So certainly we want to always sustain the best quality care for all of our patients.
And as a nurse practitioner, some people may not know, we've kind of touched on the issue of advanced education and those sort of things, and if the bill passed, you would be able to write prescriptions across the board without any third party. But what do you think some common misconceptions are people may not know about nurse practitioners?
That as a nurse practitioner, it takes approximately 9 years of education. Most nurse practitioners have already had a nursing background. So while I have been a nurse practitioner for 8 years, I have been in the nursing profession for 20. And it's not just the formal instructed education, it is everything else that culminates and leads up to it. And it's the philosophy, it's the integrity, it's the nursing model. That it's the holistic approach of looking at the person as a whole, and all the entities, all the families, everything that feeds into the health and wellness of that individual, instead of the disease process. So we just, the more we learn about our patients, through their families, through the 3 and 4 different generations of family members that come into our clinic, which is such an amazing thing to be able to see. It really provides us the insight to be able to provide the best care when you can see it across the continuum.
And with that holistic approach, you spoke about, you look at all the different entities that go into that. Is that even before making an official diagnosis?
Absolutely.
And why is that process so important than, like you said, just looking at the illness that someone may walk in the door with?
I guess a term that I say to my patients all the time is that I don't treat the labs, I treat the patient. So if you're feeling well, but the labs are a little bit off, we're not going to be too alarmed or concerned about it. We're looking at the entire package. So it's not just about medicine and parameters and numbers and black and white and something that's off. It is about, okay, so how do you feel about that? And if you're feeling well, and wellness is a balance of everything. You don't have to have everything absolutely perfect to be well balanced and healthy. Some things can be a little bit off, and you compensate in things in different ways. But just recognizing that person has the ability and the power to do that, and having more of a sense of empowerment that they have the ability to have more control of some of the disease processes that we see.
And what has been your greatest joy personally as being a nurse practitioner?
I just want people to be happy and healthy and have the highest quality of life, for people to understand and to realize that life is too precious and too short to take things for granted. Please make sure that you get your preventative medicine, your annual physicals. There are so many things that we can detect. And then the routine follow-ups, and because it's not so much, at the end of the day, I'm still going home, whether or not those people follow up or not. But in the back of my mind, I think about people and I wonder, okay, what's going on with them, or how are things, working with the families. And a lot of times I'll call people from home. You want people to have a high quality of life and to be happy. So that's what I want from my patients.
Great, great. Well, thank you so much for coming in here today and spending time and talking about nurse practitioning.
All right, thank you.
Thank you. Well, after the break, we'll talk to another nurse practitioner here locally in the area. Welcome back from the break, everyone. Kristen Saruk joins me now, who is also a nurse practitioner at the Healthwise Clinic. Thank you for joining me today, Kristen.
Thank you very much for having me.
Definitely. So what about being a nurse practitioner made you want to get involved in this career?
I really wanted to be able to provide quality care to my patients. I want to be able to educate them to make the best health decisions possible so that they can have the best quality outcomes and have the best quality of life possible for them.
And you've now been a nurse practitioner for 2 years, but previously you worked in the ER.
Correct.
How does that differ?
Oh, that's night and day. The ER is very fast-paced, in and out. I loved my job in the ER. I wanted to go into primary care because I wanted to be able to establish relationships with my patients over time, get to know them, their family, and have a little bit of follow-up.
Okay. And how does that work within the clinic that you work in now? How do you kind of build relationships with your clients?
Well, we have a lot of patients that come in, and I see their grandchildren, their children, grandparents. I see 3 generations of families that we really get to build relationships over time. It's cool to understand the dynamics and how families work. It's a blessing to be able to provide care in this community.
And being a nurse practitioner, what are you allowed to do? I mean, you kind of touched on it with building relationships, but what are you allowed to do as a nurse practitioner that maybe you wouldn't have the experience in the ER or being just a general nurse?
Sure. So nurse practitioners general from RNs, and that most have additional education, either requiring a master's or a doctorate degree, to be able to practice medicine and nursing. It's a combination of combining the 2 concepts to be able to provide care to patients. It includes assessing, diagnosing, planning, and treating patients.
And so I'm guessing then from your definition it's more of a one-on-one aspect.
Correct.
Okay.
Yes, very much one-on-one.
Okay. And why is that important to you, that one-on-one relationship?
I think that it's important to understand where a patient is coming from, what their perspectives are. If you can understand their background a little bit, you can help provide them care that is going to work for them and that is going to be conducive to their lifestyle to improve their quality of life. So one-on-one is an excellent way to provide health care.
Okay. And being a nurse practitioner, I feel like is very different than just going into your general RN and general doctor's office. How is that kind of reshaping the medical field?
I think that all nurse practitioners have an RN background, and that background is very solid in providing education to patients. So I think one of the unique qualities that sets aside nurse practitioners is being able to provide additional education to patients that sometimes in physicians' offices may get left out because of time constraints or things like that. So I think just being able to provide additional education to patients is a unique asset that nurse practitioners bring to the table.
Okay, and so going off of that, when you're sitting down with a patient, is there an extensive amount of time that you go over different treatment options with them, or if a patient comes to you with a specific illness, how does that work?
So basically, the nurse will, we have a nurse or a med tech in our office that will bring patients back. We can pull up their most recent labs and then kind of tell them where their health care is headed, make plans of care to outline where things should be going, where we want them to be, set specific goals, things like that.
Okay, so is it also very much a preventive measure too?
Absolutely. A huge part of our role is health promotion and disease prevention.
Okay. And why do you guys focus on that so much as well?
If we can focus on disease prevention, healthcare dollar-wise, it is much cheaper to focus on primary prevention than after the fact treating an illness after it's become too far advanced. So we like to focus on prevention, providing education to patients to help improve their quality of life.
Absolutely. And how do you kind of promote that to your patients? Because I know a lot of people don't necessarily like going to the doctor's office.
Oh, yeah.
And so sometimes they only go when they actually have an illness. How do you kind of promote that?
Correct. I am so passionate about healthcare and wellness. I want to inspire my patients to be able to take care of themselves. If I can kind of spend a little bit extra time telling them that, hey, if you put in these specific treatment options and follow this plan of care right now, it's going to take you much further. Your quality of life is going to be so much more improved. So I really try to emphasize on prevention and improving quality of life for patients. But it is difficult. You're right.
Right. Well, how do patients respond to that?
You kind of have to read the patient, and like I said, if you know their background a little bit, you can kind of know where you're gonna go. But most of them, once you explain to them why you're doing a certain intervention or why you're starting a new medication or why they need to monitor their blood sugars, they're very receptive once they know the rationale for why you're having them do what you're having them do. Okay,
yeah, makes sense. And so you've talked a little bit about why being a nurse practitioner means so much to you in terms of building relationships, but especially with your experience from the ER until now, what have you gotten the most out of being a nurse practitioner?
Oh, I think just seeing patients improve over time. Being fairly new, I've only been practicing for 2 years, but having a patient come into the office and then changing a treatment plan or altering it some way, and then having them come back with improved outcomes is just, it's undescribable.
Well, fantastic. Well, thank you so much for sitting down with me today.
Thank you very much for having me.
Absolutely. Well, that'll do it for this episode of Insights. You can catch us back here next Sunday. Have a good evening.
Insights into Northeast Michigan is produced by WBKB News. If you have any comments, suggestions, or topics you would like to see on a future show, please email WBKB News. This has been a production of Thunder Bay Broadcasting Corporation. All rights reserved.